Hi, good evening, everyone, and welcome to another insightful session powered by Care. Today, we will discuss the power of telemedicine, making healthcare accessible and affordable. In today's discussion, we will explore how telemedicine is enabling employees to receive convenient and cost-effective healthcare, and the role that human resource ecosystem is playing in promoting its usage as a part of their wellness and benefit program. To throw more light on this topic, we have Dr. Lavanya Ripandi, a highly experienced and board certified physician. She is a certified MD by the American Board of Internal Medicine, and she is a chief medical officer of Care as well. Dr. Lavanya has over 20 years of experience in internal medicine. She is a leading expert in the field of telemedicine and has been at the forefront of delivering high quality patient care. Without further ado, let us welcome Dr. Lavanya Ripandi to share her insights on this important topic. Welcome, ma'am, for this session. To begin with, I know the world is definitely not the same as it used to be pre-COVID, and now it's entirely changed in a lot of ways. So, in your perspective, how has telemedicine evolved and scaled up over a period of this time?
Thanks, Akash, for the introduction. Telemedicine was really not new to doctors and patients. Doctors were delivering consultations and advice over the phone to patients from the beginning of 19th century itself. It's just that there was no structure to it. They were delivering advice to their family members, acquaintances, only to some set of patients. But in the recent decades, telemedicine has really evolved with the use of telecommunications, evolving information technology. The teleconsultations have gained more structure, more efficiency. Now, especially in the beginning of 2020, when the COVID started, when Government of India has encouraged and recommended all the registered medical practitioners to deliver teleconsultations, that was a big encouragement and that was a big boost. Though earlier, a lot of champions in the field of telemedicine were delivering and patients were utilizing, a big boost came during COVID time. After that, if you see, so much benefit has come with these teleconsultations during the pandemic. Spread of disease could be limited because people were not crowding the doctor's offices. Both physician and patient were protected in some way. So I would say it is before 2020 and after 2020. Now, I think a lot of people know about teleconsultations, and especially in the age group of 20 and 45, many people have already used in some form.
Right. I think it's pretty much because the adoption rate is also increased over a period of time. And since, the digitization is anyways impacted in a lot of ways, be in terms of hybrid culture or hybrid working environment. So I'm quite sure it is definitely, one of the things which anyone is looking forward to continue in future as well. So that leads to another question, how can telemedicine benefit employees in terms of reducing healthcare cost and increasing access to the healthcare ecosystem?
Right. So one of the benefit with telemedicine is the convenience factor. When someone needs a consultation, telemedicine consultations are so convenient from their own home without having to travel a lot, without having to, sometimes travel long distance. They can avail consultations from any registered medical practitioner. They may be in a tier 2 city or even a rural place and avail consultation from a multi-specialty hospital. They can consult with a specialist if their area doesn't have that particular specialist. And because of this convenience, people tend to not postpone their medical needs. A general tendency is, when you're busy working professional, to postpone your health. Put it in the back burner and take care of your professional needs first. So the convenience factor gives prompt care, ready access gives not avoidance of postponement. The next one is cost factor. When you're not commuting, when you're not traveling, when you're not taking off from your work, obviously you're saving on costs. The cost factor is also there. And another thing is that when you are communicating, when a patient is communicating with the doctor in telemedicine model, in a teleconsultation model, everything is written, everything is digitized. real-time transfer of the records happens. Everything is encrypted. If you take chat, it is encrypted. Audio calls, their records are preserved. Video calls, similar thing. So if you take a paper and pen record in a physical visit, they can be lost, they can be destroyed. But here, everything is encrypted, everything is saved, and that leads to better continuity of care. Today, a patient in his app has all the information that is provided in teleconsultations. He doesn't have to carry any records to a hospital if at all he has to go to the hospital. The second one is safety factor. Like we said in the COVID, a lot of epidemics, infections, respiratory diseases, you prevent spread of infection. And this has been witnessed in Western countries even before COVID. During flu season, they have witnessed that when they promoted teleconsultation, the spread has decreased because it's a respiratory infection, droplets spread. And other thing is, throughout, it is not just for your family members, right? Throughout, across all ages, you can take telemedicine. Like if an employee is utilizing, he can take consultation for his kids, spouses, and parents. And in the end, when all these consultations are taken, there is structure to your health records and a certain follow-up structure is there. And you're more likely to tend and attend to the follow-ups rather than postponement, especially if you take a condition like diabetes or hypertension. There are so many people who took first consultation, but they're lost for follow-up. 2 years later, 3 years later, the condition has gotten worse. In this mode, because of the convenience, people tend to keep follow-ups, and we see that in our practice. Follow-ups are usually not neglected in teleconsultation.
Right. I think there's three interesting takeaway from this context. Is one is definitely, as a matter of fact, that you don't have to keep those MRN records file handy with you because you have everything at one shot. I really don't have to refer a lot of files. And, I really don't have to wait actually in the queue to go to the hospital and, wait for my number and, taking out my precious time. And a lot of times, for the small things like a stomach ache, headache, it's very difficult for one to go to hospital every time, hardly matters how close by it is. But again, the conveniency in terms of app or, chat is more viable because such thing is anyhow, can be created by the teleconsultations very easily in a faster way. So it leads to the another perspective, now we spoke about employees. Now from the employer perspective as well, so because again, post-COVID, definitely now healthcare becomes the focus area for everything, not in terms of, the consumers, but in terms of the corporate hubs as well. Now, in terms of employer managing healthcare cost for the employees is also one of the areas which everyone is focusing on. So improving employee fitness, they are focusing on employee wellness. In fact, a lot of companies have the wellness managers and the program managers specifically for this perspective. So what is your take on, how can telemedicine help employers to, manage and, push the telemedicines and, promote it inside their ecosystem?
Right. So if you see the employee age group, it is between 20, something like 23 to 50, the highest age group. Now, employers, typically they take insurance for their employees, and that is reactive care. When something happens, they get admitted to the hospital, and as insurance coverage is very good, that's great. But they're looking to do something more proactively before the disease happens or before the disease gets worse and people get to the point of hospital admissions. So in that context, outpatient care has really become important. When you talk about outpatient care, if you replace the brick and mortar hospital visits with teleconsultations, it saves costs for the employers. And like we spoke before, it's convenient and accessible to the employees. Again, in this age group, generally the conditions are like you mentioned: stomach ache, small infections, hair care, skin care. And because they are in the reproductive age group, it is preconception care, a small advice during pregnancy, though they have their obstetricians, postpartum care, and care for their parents or care for their babies, vaccination queries. These are the things. And other medical issues are beginning of lifestyle conditions. In this age group, because of the lifestyles, Maybe the diabetes is starting, maybe they are in pre-hypertension stage, maybe they are gaining weight and they want to lose weight. Their needs are very simple, but if they're not taken care at this point, they will become serious medical issues. That's a very important age group, not just for corporates, for India in general. We have a lot of youth. In this age group, if we don't change the lifestyle, simple medical advice can prevent long-term hospitalization, disability, lost work hours, people dropping out of workforce prematurely. Now, coming to employers, naturally, when they provide this, because of timely care and because they are happy, their needs, their medical needs are met, the family's medical needs are met, generally you see happy employees. And because the medical advice is delivered on time, health education can happen on telemedicine. If you go to a doctor, they may take like 3-4 minutes because of time crunch. Waiting room is full of patients. But generally in teleconsultation, you have set appointments. You have health coaches who can counsel you with the lifestyle changes. You have nutritionists. Everything is available in a little bit more comprehensive way. So because of this, long-term complications can be prevented, and naturally the employer benefits from this. Happy workforce will lead to more productivity and less absenteeism also. So many times we have to take half day off to take go to a doctor's appointment. Another thing is, after COVID, we have realized how important it is for the mental health. Mental health is become really, really important. And we have seen what we were seeing before was just tip of an iceberg. Now we see more light is being shed on a lot of conditions like depression, subclinical depression, anxieties, and a lot of other conditions. And telehealth, teleconsultations are the best way for psychological counseling. And not to, forget dermatological problems, ophthalmological problems, audiometry issues and all that. And with devices today, even in a corporate occupational health centers, they can provide teleconsultations. Often you see a nurse sitting there, but a nurse with digital devices can connect to a doctor. They don't need to always employ a doctor in their workplace. Another thing is there are a lot of night shift workers. If for you in the night after 9 p.m. to next day 7 p.m., it's either emergency room or nothing. But with teleconsultations, just a nurse at the occupational health center can connect with teleconsultation, doctor with teleconsultation, and get timely care, at least some guidance, whether that can be managed on the site or should be rushed to the hospital. So, I mean, if you see overall, there are a lot of benefits by promoting teleconsultations for the employees, for the corporates.
Right. I think it's pretty much because India, anyways, it's a very youthful country, and there are a lot of majority of workforces, definitely youth, and it's pretty clear that it's a clear indication because lifestyle diseases are pretty common in the youngsters, and if it's not treated at the right time, at the right age, it is definitely going to cost in all the perspective, not from the individual perspective, but from the org perspective as well.
Yes.
So yeah, I think from the preventive measure perspective, it's equally critical. From the HR professionals or the leaders, should be focusing on the org health perspective as well. Another flip side of it, which is again another question. So right now we are anyways talking about a lot of good things, a lot of pros about telemedicine. Now we have to just reverse a flip side, and we have to see, what do you see a limitation in telemedicine in future? I mean, what could be the challenges in future or the current scenarios, which is limiting the adoption of telemedicine in any perspective?
Right. So currently, still we have a generation who prefer hospital visit, sitting in front of the doctor, interacting with them. We have had a culture of, bonding with the doctor, family doctor concept, and still there is a generation of people who still want that. So there is that barrier, but I wouldn't say that this is the downside of telemedicine. But for your question, one of the factors that maybe slightly limiting factor for teleconsultation is that a lack of that personal touch or lack of that long-term connect. When you take in-person consultations, when you go to video, there is certain decline in personal connect. When you go to audio, there is further decline because you are not able to see the visual cues. You're only hearing the voice. When you go to chat, both audio and the visual cues and audio listening is lost. So when this is there, A, a doctor-patient relationship may not go to the best levels. Generally, there is a rapport between doctor and patient. There is certain trust. Here, we can't identify the patient, especially if it is not a video call. In audio call, identification of the patient becomes difficult, and this personal touch becomes difficult. But again, with more and more touch points happening, it becomes little more easier. That is why the continuity of care and being in touch with the teleconsultation provider is very important. It should not be considered as just one-off acute visit. And this is one-stop solution for even your chronic needs, your follow-ups, post-operative follow-ups. The best scenario is when you went to the hospital, saw the doctor, and then after that you follow up, like post-surgical care. Surgery has happened and you're following up with the surgeon. So you have everything there. You have your connect. You don't have to commute from your town again for post-operative follow-up and so on. But even otherwise, like the important point I want to make is going forward, teleconsultations are going to only pick up more momentum. We have to not forget the human factor, both patient and doctor. And another limitation is that how much ever you can provide advice in teleconsultation, there is certain limitation. As per the guidelines, you cannot prescribe certain medications on teleconsultation. So sometimes the doctor cannot do everything he or she wants to do. So he may be referring the patient to a clinic again to see their physician. So this can create some dissatisfaction in the patient. But generally, this is for their own good. Certain times examination is very important. Physical touch is important. So both the doctor and patient should know the limitations. Yes, teleconsultation is good, but there may be times that I have to actually go to the clinic. And doctor also need to realize that there are certain limitations and not go full length and take things into his hand when he should actually be referring. So that is another limitation. And other one is emergency scenario. But even in emergency scenario, there is always some good advice doctor can provide. Like, for example, during chest pain, simple advice as take aspirin while you're going to the hospital, while you're rushing to the hospital. That can really save a person's life. So these are some limitations.
I know that's pretty interesting. The world is evolving, and definitely I'm quite sure in future digitization will anyways crack through that perspective as well, where we can bring the human touch in the whole digital process, the connect between the doctors and the patients as well. Now the second perspective is definitely telemedicine also helping the dependents as well, because I stay with my parents, so not necessarily I want them to visit hospital along with me for any basic things and all. So I myself take a lot of consultations for dependents as well, and which is easy for them as well and for me as well, for the basic for the recurring checkups as well, because the doctor know the history. I mean, the chat doctor also a lot of time know the history of your dependents, and it's easier for them to recommend a lot of things then and there itself. Yeah, so okay, another interesting questions, which we have another one question left, from my side, and then probably we'll take the forum for audience question. What role do you think right now the HR community is playing to push and promote and market this entire, healthcare or telemedicine system, or packaging and, giving their employees the best of the wellness benefit programs? So what is your take on this perspective from the corporate angle?
Sure. In a way, HR leaders are kind of like gatekeepers for employees, employees' information. Today, there is so much available out there, and HR leaders play a key role, as you know, in curating that, lot of content and providing the valuable services to their employees. There is so much available, and there are certain evolved telemedicine technologies where they can get everything on one platform. Like, for example, teleconsultations just don't end with consultation. You can write then and there book labs without having to go to the lab. Home sampling is available, pharmacy delivery is available. So it is up to the HR professionals what kind of services, what kind of comprehensive services they would want to provide to the employees. Things may be available, in disjointed fashion. There are so many apps available today with consultation. The key thing is to take those kind of services where they're more comprehensive, where everything is in one place. The other one is that utilizing after the teleconsultations, utilizing the aggregate data and take further steps. For example, though individual data is not available, they may know that that particular corporate is having more people that have high BMI or more people that have pre-diabetes. What do they do with that data? How do they utilize that data? Maybe they want to take care management program for that particular condition, because they do have spend, they can spend, but utilizing that and meaningfully spending it is one thing, utilizing the aggregate data. And last one is they are the champions for their corporate. We often see that, when they promote, when they encourage, a lot of things happen from the employees side. If they themselves champion teleconsultations part, if they try it first, then employees are more likely to utilize. Today, everybody has so many apps on their phone, people tend to forget what their provider is providing. So nudging the employees a bit and championing the whole teleconsultation thing is really, leaders can make a lot of difference.
True, I think I second to that, because if key opinion leaders doesn't promote that, then it's very difficult internally, to take, because they are the ones, who set the things right, and whom people look up to, for any sort of advice internally, and the guidelines which layoff has to be followed accordingly. So yeah, I think that's pretty relevant, how leadership team is promoting internally and how focused they are towards the health and wellness segment. And that's how you see the transformation, throughout the organization, by adapting all those healthcare services. Well, we have one question from the audience. So probably I'll just read it out. So anyways, we have answered this before, but again, what do you think, how we can bring the personal touch in digitization of telemedicine, how we can bring that in future?
So one of the things is, when you have a chat option or phone call option, book a phone call, try to talk to the doctor. Generally, we see a tendency, especially with the younger age groups, they prefer chat consultation. We sit in neighboring rooms and we do send emails to each other in today's world. So when you have a phone call option, prefer phone call option, listen to doctor's voice, you'll be able to communicate better. And then another thing is more touch points with the provider. If you are going to different providers, like one physical consult, one teleconsultation with one corporate, and shopping around with another consultation with another telemedicine provider, your records are disjointed, you have multiple apps in your phone, and there is no continuity of care. Generally, when doctors practice telemedicine in one company as a group practice, they have access to each other's patient's records when they see the patient. So multiple touch points with the provider is one thing, how you can maintain continuity of care and keeping your follow-ups. This is not just telemedicine problem. Even outside, people tend to not keep follow-ups. They think temporarily getting better is like an excuse for not attending for follow-ups. Always we should keep follow-ups to update the doctor and to get further advice. Generally, when you go for acute care, all this tell you are important steps to take care of that particular condition. When you get better is when they give you health education, health coaching to prevent further occurrence of that condition, be it back pain, be it neck pain, be it skin rash, allergies, anything.
Right. I think that's bring us to the closing segment of the entire thing. First of all, thank you, doctor, for such an insightful session. I'm quite sure everyone is looking forward for using telemedicine because it's convenient, accessible, and especially youths, because they, as you said, they are on chat, they're on email, so it's convenient for them. And we still see that a lot of even beyond youths, people are still adopting the telemedicine as a perspective in the daily routines as well. Any closing note or any closing remarks from your end before we close this? Yeah.
I think teleconsultation is here to stay. It's just that when we are going to start using it, like I said, pre-COVID, post-COVID, we see a lot of acceptance in people.
Right.
So I just would like to see more people utilizing it and understand the limitations also while you're utilizing. There are certain things that you cannot get accomplished during a teleconsultation. Understanding limitation is also important for the provider and the patient.
Right.
But yeah, good things are going to happen with in terms, especially across the world, healthcare costs are soaring high, especially in Western countries. They
Absolutely.
have realized it, yeah, late, but we are realizing little early. Comparatively, in India, healthcare costs are really not that high compared to other countries. If we utilize these technologies, we can keep it like that, or we can even get better.
Great. I think, thank you, ma'am. It's pretty insightful. And as you know, I would like to close this session with a remark. Since India, healthcare is pretty cheaper compared to Western world, the other countries, I think we always have an edge to utilize it in all the perspective in terms of preventive healthcare as well, because people usually tend to miss out the preventive measures, in terms of the entire thing. So people usually go to doctor when something damage has already happened. So I think I will also encourage the audience, who is watching this webinar and the session, please do use and use the telemedicine perspective in terms of emergency or preventive healthcare perspective as well. Well, thank you, everyone. Thank you, Dr. Lavanya, for such an interesting insight.
Thanks.
Looking forward for an upcoming session as well. Thank you.
Thank you.